Welcome to the Reverse Mullet Healthcare Podcast from BP2 Health. Saying that out loud is still funny to me. It makes it real.
Did we really pick that name?
We did. Yes, we did. And we did because we want to have fun while we're doing this. We want to be entertaining. And, of course, we also want to be relevant and informative. It's like party in the front, business in the back, like a mullet, only reversed.
Which is exactly how I explained it whenever we sketched out the purpose of this healthcare podcast. So that's kind of our MO, right?
Yep.
I'm Ellen Brown.
I'm Justin Politti.
And I'm Dave Pavlik. We are passionate, innovative, and collaborative, and we're committed to solving our industry's most pressing issues together with our clients. We have a combined 90 years experience.
That makes us sound so old.
We are.
Exactly.
We kind of are.
In each topic, we're going to dig into a hot healthcare topic and dig into each other.
Be gentle on me, please, guys.
You be gentle on us.
No way.
No chance. So we're recording our first podcast here at MMG Studios in Tampa, Florida. Why are we in Tampa, guys?
The world's largest bowling pin.
What?
We didn't see it, though. But that's not really why we're here. But we are going to talk about innovation today, Dave. You forgot that
Yeah,
piece.
but let's talk about why we're here in Tampa.
All right. So we all have kids, right? And so Justin and I dropped ours off yesterday at college.
Literally right across the street.
Yeah. Like my daughter's coming to grab something, I think, from the studio. She's so close.
So you guys, both of your children, ended up at UT.
Spartans.
Yeah, they're Spartans, and it's random because they didn't meet until, last summer?
Yeah.
And
yeah.
How did it go? How did drop-off go? I'm a veteran, so.
Yeah.
I've
Both
been
of
there,
yours are gone, done.
Mm-hmm.
Yeah.
This was amazingly efficient. I was so impressed. My older son, it was chaotic as
Maybe
hell.
we could get University of Tampa to redesign healthcare.
I know, seriously, that'd be cool. But no, I was really impressed. And I spent most of my time putting together, I got cordoned off into the corner and go build some rack of some sort for my kid while Shan took over the room and figured everything out. But Will adapted perfectly, and he did well with scoring good on a good roommate. So
There you
now
go.
Sophia.
Sophia's great. Shockingly, she took over. I don't know where she got it from, but she took over getting herself all organized. And then what made me feel bad was that the other group involved in the room was complete opposite. And after the fact, I asked Sophia, I said, did I have one of those mom moments where I wasn't where I was supposed to be and I let you down? And she was like, no, it's exactly what I wanted. I wanted to do my thing. I wanted to do it my way. And I was so happy. I was really glad you let me do my thing. So my big job was kind of in the middle. I had to ride the bike to Walmart and get a surge protector. So
Rode the bike to
yeah,
Walmart
because the car was parked too far from the dorm, and it was a total cluster on campus. It was very organized, but driving anywhere was a nightmare. So I rode and then I kept riding around, and I got a gift certificate and some cards for her. So
I'm just realizing I think I almost hit you because I had to drive to Walmart too, and I had to pick up a hamper. That was my task. And but yeah, I just saw this woman on a bike crazily driving, and
it was probably me.
I probably swerved and almost almost did not have the podcast.
So I think our listeners are probably done listening to us.
Yes, I'd agree.
Because
we could do this all day long.
Were there any tears?
None. Oh, my husband did cry a little bit when he left, but partly we're still in Tampa, so I haven't truly pulled the cord. I'm going to see my daughter one more time, so I can't. It was very sweet, though. I don't want to make fun. Yeah. It was very sweet.
All right. Well, you're right. Let's.
Okay. Okay, I'm going to get all nerdy now.
Let's dive in.
Okay. So.
Oh, but wait. Time out. We do have a sponsor.
Oh, yes.
We have a
Dave,
sponsor.
We have our sponsor for our first podcast.
Have you guessed?
I haven't figured it out, so this is going to be a total shock.
Guess.
Okay, just do it.
Okay, P3 Health Partners.
Oh, all right. That's cool.
P3 Health
awesome.
Partners.
Yeah, it is.
That's great.
They volunteered to be our sponsor.
That is awesome.
Yeah.
P3 is a population health management organization founded and led by physicians with a strong background in value-based care. Contact P3 to find out how they can help you improve outcomes, lower costs, and help enhance the health and well-being of your patients. People, passion, purpose. That's P3.
Shout out to P3.
Find them at p3hp.org.
Very cool.
Back to
See,
you,
now
Ed.
we sound like legit. So
Exactly.
So hats off to P3 for giving us
Yes.
that. So, All right, so in planning this podcast, we talked about really what BP2 Health stands for and why we want to do this podcast. And so we're all about change, right? Our little logo even says it, your chance for real change, because we
Best
do believe
chance for real change.
it is the best chance for. Did I say that wrong? Maybe.
Close enough.
Okay, all right. Anyways, so really getting serious here, the party's over, is innovation was what really came to mind when we started talking about change, and the lack of innovation, and really the fact that our industry so desperately needs drastic change. So being the studious one that I am, I started writing down notes on innovation for this discussion. And you know me, I have to have a framework for everything. And what I realized was innovation is like this big amorphous word. And so I needed to have a definition and I needed to have a framework. So I looked in the dictionary.
Wait, what?
Okay,
go ahead. So
So I went into the.
This
so
is
I did
totally
not.
par for the course.
I
for
did
Alan.
not do Wikipedia because that's too internet. It's not like legit. So I looked up the Webster's dictionary definition, and the definition is a new idea or method or device, aka novelty, or the introduction of something new.
Okay. I think it's helpful if we break down those categories a little bit, though. They can totally overlap, right, in innovation. But technology comes to mind first, development of new products, treatments to improve care, new drugs, new medical devices, et cetera, et cetera. What else?
There's your thing. Justin couldn't find his place.
Business models.
You talk about them a lot.
I know. Horizontal, vertical integration, EHR, interoperability, population health, and the like.
And then the third category is consumer focused. So, which I talk about a lot, but really changing the way that consumers buy and use healthcare. And you'll hear me talk about this a lot, wearables.
Ellen
and her wearables.
Ellen,
I have them.
she talks about wearables
I wear them.
everywhere we go.
I talk about them because there's so much really great information, joking aside. So, all right, so let's talk about these three categories because really, right, you have innovation and it's all over the board. So if I have to go and talk to a client or talk to a board about innovation, I need to have a framework. So for me, I'm looking at what we just talked about, right? We've got technology. So is the money going into technology? Is it going into consumer focused or is it going into business models? And the three of us, when we talked about this, is where we get really super frustrated is, right, Justin, the business model is what desperately needs to be overhauled here. But everybody's attracted to the shiny objects.
Everybody
right?
goes
Just
after the
like
shiny
my
object.
wearables,
Exactly.
Right? It's everybody's, so that's a problem.
Yeah.
Yeah, and the business models, just like, kind of everything else that we're talking about, can be a little bit boring. And the reality is...
It is boring. We need to get a boring
We are going to get a boring button.
Somebody hit it. Boring.
Okay, sorry.
But, all right, back to this. The brass tacks of where you can make the most change is within these business models, right? We've got to delve deeply into them and figure out how we innovate in a way that, can change those models.
And we have to invest money and time.
Well, that's just it, too, and not make it boring.
The technology itself.
AI?
I mean...
Is that not what we hear like every 30? AI.
Yeah, AI. But what is AI? I mean, a lot of people think of AI as just predictive modeling. Predictive modeling's been around for a long time. AI is more of, let's find ways to have a machine interpret an X-ray or a machine, come up with diagnoses, predictions that are more than just looking at data, right?
Yep. There's actually AI being used now on the business model redesign, like on workflows and offices, and like AI is starting to become a tool. So technology and business models are obviously coming together, but still you have to look at the premise of, is it predominantly the business model that you're investing in? Is it predominantly the consumer that you're investing in, or is it the technology, right? It's those three buckets. You still have to kind of put a title on them. Justin, we're rambling.
back to that AI component and the business models, I think one of the core concerns that I have within this space is how AI is being applied to the business models. For instance, with claims payment, like there are different auto adjudication mechanisms that these AI methodologies come up with. And the risk is they can result in inaccurate denial. And then
Overpayments, underpayments.
And then all of a sudden you've got consumers stuck with bills that they wouldn't normally have, or this whole frustration because of some automated system
that used history.
To be able to basically upend your life.
That's a good point.
And these are all things that are going on and things that we're going to have to really, I think, get to the bottom of as we're implementing all these different ideas.
So those are the categories, right? We just talked about them. We've got technology, business model and operations, and customers. But how do you figure out, like, what are all the different pieces?
When you say customer, who's the customer?
Well, consumer focused. Sorry, I keep saying customer.
No, that's
it's
okay.
Consumer focused when it comes to innovation. So, but yeah, I mean,
the consumers
so
of
if we
healthcare.
want to actually, so let's talk about the forces that affect innovation, right? What's your favorite force?
Technology. It's multifaceted, right? Services, anywhere from services to infrastructure, because those are really what kind of starts innovation. Technology is the beginning of much of the innovation.
Yep. But then you've got funding, right? That's a force. It drives all of this, but we have to fund and figure out where the money goes. And then what you asked me before about customers, right? Mm-hmm. So again, you've got consumers in that top category, but then in terms of all these different forces, you have customers driving the change. But here's the thing, like, to me, healthcare is so confusing because everybody sees themselves as a customer versus a consumer, but then they like put those two words together interchangeably, but they're different. And so when we talk about innovation and we talk about funding and the customer, it's the passive patient, the person that we all know those people, they just want to be treated. They don't want to do anything. They want a pill. They want the technology. And right now, the way the healthcare system's designed is to love those people. They're like, sweet, I can make a bunch of money. I just feed them a bunch of stuff, you know? I mean, I've been dealing with some health stuff with our family, and the amount of pills that are offered to each family member every time is like, take this, and what about that, right? It's crazy. Then we have the engaged consumer. I have my wearables. You guys know what they are, right? I'm the engaged consumer. I go out and I pay for acupuncture. I go out and I get rolfing done. I get all these crazy things done to take care of myself.
What kind of information is on those wearables?
So I know how much deep sleep I get every night, which has actually been really helpful. I know my heart rate variability. Okay, I can see it in your face. Everyone's getting ready to make fun of me. I'm just going to move on. So I'm an engaged consumer. And then the last bucket, which has its own subcategories, why do we think innovation's so amorphous, is health insurance purchaser, right? So that's what makes health insurance and healthcare so confusing, is that you've got the person consuming the healthcare, and they aren't even the people that are necessarily buying the insurance benefit to pick what's covered for them. That's their employer. It can also be the government. It's a whole slew of, so you have the insurance company, you have government, you have Medicare and Medicaid as payers, right? And then you also have self-insured employers that are also their own insurance company in essence, and that's who's picking the benefits. And so it's kind of a misalignment. It's
a universe of middlemen.
Yes, that's a very
well said.
That's a very good description.
And there's accountability. So all these middlemen you're talking about, right? There's accountability, and that piece can be a major barrier for the innovation.
Well, I think this is the biggest barrier right now to innovation, honestly.
If everyone that's investing, right, the investors, they got to show cost effectiveness. They've got to, and that's not easy, basically, right? Because it's really about cost avoidance. So you've got your CFOs and your...
They want the ROI.
What's that term? Takes money to make money? Yep. And in this case, it takes money to avoid future spending, right? Exactly. And that's really hard to get people to wrap their heads around and get on board with.
Our industry is too quick.
Yeah.
We're not long term. You buy your insurance plan based on how much it is this year. Your employer is doing the exact same thing, if unless you're the right, but if you're going through your employer, which most people do, the employer is the one that's already decided that whoever is the cheapest that particular year. So then that's what you get. And guess what? That insurance company at most is going to be that insurance company in another year. Then you're going to switch. So if that first insurance company invested a bunch of innovation into you avoiding cost,
Yep.
they don't realize that savings. And so what we're seeing, right, is with clients, with relationships in the industry that we have, is that all these great new innovative things have been created that are so powerful, but we can't figure out how to get them deployed in the mainstream. Like, we can't get the traction behind them because we have to prove cost savings, but yet it's cost avoidance, right?
So what you're saying is we're all doomed.
Well, are you going to push the boring button on me?
No.
No? Okay. It's just the whole, like, doomsday. All right. I'll be more positive. That's why we're in this, right? Because, no, I mean, joking aside, to me, that's what makes this all so important for us to be involved, is to try and know what the problems are, but then actually try and solve them, right?
Yeah.
So, I don't know. But anyway, so I think we've talked about all of this in a more amorphous part. So I'll put my geeky hat on, and you all know how I am. I like a good slide deck. I'm all about the visuals.
Yep.
I think when we do this podcast, we have show notes.
Yep.
Okay. And so I could actually put a slide. This will be really cool. I could put a slide in the show notes to explain what I'm talking about. But because I'm dorky, I drew something. So it's very ugly. It's not PowerPointy. So I basically showed the axes of, on one axis, you've got technology, business model and operations, and customers. So if I'm talking to somebody and saying, okay, innovation, how do I as a company, how can I be innovative? So do I want to be innovative in business model and operations? Do I want to be innovative in technology? Do I want to be innovative to my consumers, right? I'm going to look at those three buckets.
Can I be all of the above?
You can. You could have something that falls into all those categories, absolutely. And I'm only talking about myself as the organization. And then I'm going to say, okay, what are all of the different players that are involved? And that's the other axis, right? So the other axes is going to be industry players, public policy, technology, funding, customers, and accountability. So then if I say, okay, in technology, I'm going to invest in blank, right? Then I'm going to say, okay, what are all of the different drivers over here that are going to hit into that thing I'm trying to do that's going to impact me, right? And then I'm going to go through that process with all my innovation. And then I'm going to say, okay, now what are my competitors doing? Because that's the other thing, is you can't think about yourself as an innovator if you don't think about what's going on in the universe.
Right.
How
do you keep up?
Right.
What are your competitors
right.
doing?
What are they doing? And I do the exact same exercise. I'd say, okay, what innovation is a threat to me? Or what innovation is pushing me or do I care about? And I do the same thing. You know, what areas are they? And to me, that'd be pretty much, I think there'd be a little bit of an aha. If you were able, again, you take this very amorphous word that the board and the everybody you're handling at a leadership level that's like, whoa, how are we innovative, right? Then if you can actually show something to say, we've thought about it, right? We've put it into a construct for you, a framework for you. I think it's really helpful.
So I'm looking at this and I'm thinking, this is
I
why
need to actually put it in PowerPoint because
this is why we pay you the big bucks. You are able to synthesize a topic like this and kind of quantify it in a way that visually appealing. But I think that right there is the critical takeaway from today for me. Like, you're able to basically provide all this stuff in a way that is, visually appealing.
You guys always are so sweet.
Sometimes we have to be. But how do you? But would a regular person in any given organization understand that?
Yeah,
They can understand it with the visual.
I think so.
That's
why. Because I think what happens is we all like to talk, just like we're doing right now.
Right.
But then you get into a setting where you have to explain something. And you have to make a case for something.
And they get glossy-eyed,
like,
and fall asleep.
They're like, well, what about Amazon? Or what about this organization or that organization? And then you stop for a second, you say, wait a minute, what is that organization doing? And am I doing the same thing? And you got to step back. In fact, when we all started talking about this podcast, we were 3 steps ahead when it came to change, right? We were talking about how not enough change is happening, and how do we talk about it? And then I'm the geeky one that took us all the way back and said, let's go back to the beginning and talk about innovation and the definition and create a framework. And luckily it made for good banter because you guys are fun, but
we're on the verge of boring people right now.
all right. All right. Okay. All right. Well, so we talked about all the things that we wanted to talk about today. I think this would help people hopefully apply it to their organization and really look at things in the future. So
A lot of the things you just mentioned are for a future episode too.
well, you're giving it away.
It's okay.
All right. All right. Okay.
What do they call it in the industry?
A teaser?
A teaser?
All right. Yeah,
I
that's
don't
a
know.
teaser. I don't know. I would
We've
have
got
never
to start
gotten
using
that
these
word.
buzzwords now that we're.
Yeah, no, we don't. That's what makes us us. Okay. Thanks again. I'm Ellen Brown.
I'm Dave Pavlik.
I'm Justin Politi. We are the partners at BP2 Health, your best chance for real change. As you can tell, we could talk all day about healthcare. Drop us a line through our site, bp2health.com.
The Reverse Mullet Podcast is produced by Henry Street Media with Kim Rittberg and Emily Newman.